Welcome to the Jack Rice Show. Looking at where the country is going, I think the issues that are impacting our pocketbooks the most are probably gasoline right now, but they're followed very closely by health care and a whole series of other issues. So we turn to Congressman Tom Price out of Georgia. Congressman, thank you very much for joining me.
Great to be with you, Jack. Thank you.
I would have to say, and I think we would all agree, at least the latest polls would say so, the number one issue, the number one concern amongst Americans right now is the economy. And I think the thing that hits them most, at least it hits me every time I have to go to the gas station, is the price of gas.
Well, you're absolutely right, and sometimes I ask folks whether or not they filled up their gas tank today because that dictates their mood.
Amen.
If they filled up their gas tank, they're not in as pleasant a mood, and rightly so. It's affecting so many things, affecting commodity prices, food prices, and raising the cost of virtually everything from transportation to anything else all across this nation. And Americans have a right to be frustrated and irritated with their leadership, because there has been a crisis of leadership here in Washington on many things, but not the least of which is our energy policy. Today we're rolling out our conference, the Republican conference is rolling out a four-step policy plan, action plan to address our energy policy in this nation. First is to make certain that we accentuate and utilize American resources for Americans. We've got incredible resources in this nation, whether it's shale oil or whether it's clean coal technology. The technology to utilize these things in an environmentally sensitive and sound way has just expanded incredibly. We ought to be using it so that we're less reliant on foreign oil. We ought to aggressively pursue alternative fuel and not have Washington pick the winner of that, but have entrepreneurs and people with great vision and minds and technological capacity to determine what the best alternative fuel.
But Congressman, if we look at that issue specifically,
sure.
One of the things that we have talked about over the last couple of years that this president has been harping on is let's let this free market deal with it. Well, you know what? The free market has taken us down this path, and when we can look back to 2005, the energy bill that ultimately was signed into law, they didn't set any standards for miles per gallon. They didn't force money down particular paths. Instead, what they said was, well, we'll let the free market deal with it. You and I both know the free market isn't about public good. It's about making as much money as possible, and ideally everybody will benefit. Right now, we're looking at $4 a gallon for gasoline, and it could get substantially higher. I think if ExxonMobil has anything to do with it.
Yeah, but what is this? Isn't really a free market. What has the market been distorted to do? The market's been distorted not to have a new refinery come online in the last 30 years. That's not a free market. That's a market that is responding to the liability crisis and the regulatory crisis that we have in this nation. If we would incentivize those kinds of things, we would have greater refineries and greater capacity for oil. A true free market, something that the government could do, would be to incentivize alternative fuel. What if we gave a $10 billion prize to the first individual in this nation that could come up with a car that they could sell for less than $25,000 that would get more than 100 miles per gallon, or the equivalent of 100 miles per gallon in whatever technology it used, and could mass produce it? What if we did that and spent $10 billion that way, instead of spend $10 billion to subsidize a particular product all across this nation that then has a ripple effect of increasing food prices and commodity prices and distorting the market instead of a free market? Those are the kind of visionary things that we need to be doing as a nation, not having Washington pick the winners and losers in all of this.
Who do we blame for this? I know that the Democrats for years blamed the Republicans when they controlled both the House and the Senate for those 6 years. I heard the Democrats up and down screaming about the inability of the Republicans, and of course now I'm seeing the Republicans do the same with the Dems, and they did before the Dems took control previously, had control before 2000 in that reign.
Well, it's less important who we blame than that we move forward positively. As I mentioned, I think there's a crisis of leadership in this town, and frankly, it runs across party lines. The leadership needs to be able to stand up and say, look, we're going to solve the challenges that we have in this nation, and we're going to solve them together. Right now, the majority is all about politics all the time, and so their energy policy, all that their energy policy is to increase taxes on domestic oil producers. Well, that doesn't make any sense. When you increase taxes on domestic oil producers, all you do is decrease the domestic supply of oil, and you increase our reliance on foreign oil from, frankly, nations that don't like us very much. We need to come together and solve these challenges positively and productively. What about tax incentives for conservation? You talk about trying to get folks to do the right thing. Energy-efficient homes, those kinds of things, utilizing, making certain that government buildings are energy efficient, making certain that homeowners have an incentive to make their homes efficient, providing tax deductions for increasing their efficiency. Those are the kinds of things that we can positively do together and should be doing together.
As an orthopedic surgeon, I know one of the areas that you really focus in upon is healthcare.
Mm-hmm.
And I have to tell you personally, when I look at this issue, my youngest daughter was diagnosed with epilepsy about a year ago. And while I have insurance, it has been absolutely devastating, not just emotionally, but I'm talking financially, because of the cost of health care. And if we look at the number of people who have filed for bankruptcy over the last number of years, the number one reason is health care.
Right.
I mean, the system is broken fundamentally.
It is, and I would suggest to you that it's broken because of governmental intervention into it and what it has done to the system. I support and have a plan. H.R. 2626 is the bill, if anybody's interested in looking at it. Have a plan that would provide for making it so that every single American has a financial incentive to own their own health insurance policy through a process of tax deductions, tax credits, refundable tax credits, advanceable refundable tax credits. So there's no reason that any American ought not have access to the highest quality medicine. And they ought to be able to own that policy so they can affect the medical decisions that are being made. We are moving away from, and have for the last 15 to 20 years or more, patients and doctors being able to make medical decisions. That's not what you want. It's not what I want. It's not what Americans want. Americans don't want Washington making decisions. If we want the kind of efficiency in our healthcare arena that we have in our energy arena, then go ahead, let the government take it over. But frankly, the federal government cannot run healthcare and can't do it well, and consequently, we ought to move toward a system that allows patients and doctors to make medical decisions.
And yet at the same time, I've talked to a lot of CEOs who are being crushed by the cost of health care. I've talked to governors around the country who've also been crushed in terms of their state costs that are going to this. If we simply divert all of those costs to the individual and give them a tax credit, how does that really address the problem? It doesn't make it any cheaper necessarily, and all of that means is the crush is coming down exclusively upon the individual rather than upon the larger organizations too, isn't it?
What you would actually get is a greater ability of individuals to make decisions, and consequently a greater level of competition and a greater responsiveness of the system to patients. Right now, the system isn't responsive to patients. It's responsive to human resources officers in companies, and it's responsive to bureaucrats in both insurance companies and the government, because patients aren't allowed to make decisions. How do we determine what anything else in our system ought to cost? We allow the market to determine what that cost will be. And if we have a clean system that allows for individuals to make healthcare decisions in consultation with their doctor and with their families, then we would approach a system that would be much more responsive to people, and it would also be much more flexible in its pricing. We, in essence, have price fixing right now in healthcare from the federal government through the Medicare system, and all other insurance is tracked off of Medicare. And that's one of the reasons that we're in the dilemma and the difficulty that we're in, because the federal government is not interested in the quality of healthcare for individuals. It's interested in determining what the cost ought to be. We need to turn that system on its head, because it isn't being responsive to those that are most affected, and that is patients.
Well, if I recall, and this wasn't that long ago, when for our elderly we were dealing with drug costs, and what we said was, let's let the market run and we'll let them compete against one another. What we have found is that those prices didn't come down. The cost of it was extraordinary for the American people.
Well, in fact, I was not here in Congress when the Medicare Part D proposal for prescription drugs for seniors was passed. I'd like
you couldn't have been for that, could you?
I'd like to think that if I had been here, it wouldn't have looked like it did when it came out the end. I don't think I would have been able to support that. But by the same token, when we look at the projections of drug prices through that program when it was inaugurated and where they are right now, in fact, the prices have been less than were projected. Now, it's not an ideal system by any means, and frankly, it again removes patients from the ability to determine what medications they will have available to them. I would have a much more dynamic and a much more flexible and patient-responsive system, and that's what I think we need to move toward, as opposed to the CMS, the Center for Medicare and Medicaid Services, making more and more personal health care decisions for each and every one of us.
Congressman Price from the great state of Georgia, thank you so much for joining me.
Thanks, Jack.